Good morning. Welcome to a special edition of the Georgia Cancer Center's Facebook Live Q&A series. With all the concerns surrounding COVID-19, the coronavirus, we wanted to share information about how this virus can impact a cancer patient's life. Also, March is Kidney Cancer Awareness Month, so we're also going to be talking today about kidney cancer to help educate you about this disease so that you can share information with your family, your friends, your coworkers. Joining me today is Dr. Zach Clausen. Dr. Clausen is a urologic surgical oncologist at the Georgia Cancer Center. Dr. Clausen, thank you for joining me today.
It's a pleasure, Chris.
So, in preparing for today's discussion, I did some research using the National Cancer Institute's coronavirus resource. I'd like to share some of the common questions from that page and get you to share the answers with our Facebook followers.
Sure.
First question is, if a person has cancer, are they at a higher risk of getting the coronavirus?
Sure, that's a great question. So there's several risk factors that lead to increased risk. So, I'll get back to the cancer question in a minute, but certainly people over the age of 60, people that have pre-existing respiratory problems, people with diabetes, hypertension, and certainly cancer falls into that. So the reason cancer patients we think are at higher risk is because they enter what's called an immunocompromised state, which basically means any treatment, whether surgery, radiation, or chemotherapy, will decrease their immune system and make them susceptible to it.
Okay. Are people with cancer at a higher risk of dying from COVID-19?
It's a good question. At least some of the early statistics out of China and northern Italy suggest that any of those risk factors do increase your risk of mortality from the coronavirus. Most people who are young and healthy may have symptoms almost like the regular flu, and so to answer your question, they may be higher risk of mortality, but any of those other risk factors are as well. So it's not necessarily if you get it you are going to die from it, but certainly it probably does increase your risk based on what we know from the early statistics.
Okay. Now we have a question also. If a person is diagnosed with cancer, what steps can they take to protect themselves from contracting the coronavirus?
Sure. So obviously a cancer diagnosis at any point in time is a difficult situation, and even more so in the uncertainty that we're living in today's last couple of weeks, especially in the United States. And so there's general precautions that we all should take, whether we have a cancer diagnosis or not, but certainly these precautions become even more paramount for cancer patients. So not just cancer patients that are newly diagnosed, but especially ones that are undergoing treatment. Like I mentioned before, chemotherapy, radiation therapy, surgery, all of these will decrease your immune system and lead to a higher incidence of getting the coronavirus. So, general precautions that we all should take, like I said, hand washing, 20 seconds, soap and water is probably your best bet. Social distancing, we've sort of heard this term over the last couple of weeks. And so maintaining, 6 feet between people. Not joining big groups. Avoiding big groups and being cognizant of who you're around. So a lot of the questions also come up around follow-up appointments, and we're really working here at the Georgia Cancer Center to get people triaged as to who we need to see in person, who we can make a phone call to, because life goes on. People still are coming in with new diagnoses, and that makes it difficult to have to delay or a discussion based off of the current climate that we're in. So I think just to summarize how they can protect themselves: avoiding big groups, hand washing, don't touch your face if you don't have to, avoid groups more than 10 like the CDC's mentioned recently as well. So just taking the usual precautions you would for the regular flu, but even heightening it with this recent coronavirus pandemic.
Okay. Now we did get a question submitted. It says, where to get tested is my question. I am a cancer patient at Augusta University at the Georgia Cancer Center. Dr. Bunger Rungran is this person's oncologist. They say they have symptoms of cough, headache, and fatigue. They want to get tested, but they were told not to go to the emergency room. This person says they live 80 miles from Augusta, but can come to wherever they need to go. So
Sure.
What should they do?
Well, we've had some great leadership with Dr. Kuhl and some of our leadership with the medical center, sort of setting up screening opportunities. And basically the first step is to call our sort of patient hotline if you have these symptoms, as she mentions, 706-721-1852. And so they'll sort of take it from there. As an oncologist, I'm not an infectious disease physician, but I know that as clinicians, we all have to be cognizant of taking the appropriate steps, and certainly anybody that's concerned should call the hotline, go through the screening, and then they'll decide from there where and if they need to test.
Okay. Now, if y'all out there have any follow-up questions, please submit them to us. You can share them in the comment section. We love direct messages as well. We will get those questions answered for you and sent back to you. So thank you for talking about that. Lots of questions, and I'm sure things will continue to develop.
Absolutely.
And now we want to take the second part of our Facebook Live Q&A. This is our discussion about kidney cancer. As I mentioned, March is Kidney Cancer Awareness Month. I see you have your ribbon on.
Proudly wearing my ribbon for March.
So, Dr. Clausen, how common is kidney cancer?
So kidney cancer is the 6th most common cause of cancer in men and the 8th most common in women. And that estimates from the most recent cancer statistics that come out every January suggest about 74,000 new cases in the U.S. in 2020 and about 14,000 mortalities. So it's not the most common, such as breast, colorectal, and prostate, but it certainly is in the top 10 for both genders.
Now, I know there is not a traditional screening method for kidney cancer like mammograms for breast cancer, colonoscopies for colorectal cancer, but there is kind of a common way kidney cancer is detected. It's through incidental screening. Talk about how that happens, what that is.
Yeah, so incidental screening means that it's picked up when you're looking for something else. So for instance, let's say somebody comes to the emergency room, let's say they have a GI bug, so they do an ultrasound of their abdomen and they find there's something on the kidney, looks a little bit suspicious, so then that's followed up with a CT scan. So the kidney cancer or the kidney mass was diagnosed when you're looking for something else. And so we find a lot of the small renal masses anything less than 4 centimeters, a lot of those are picked up incidentally. So you're right, there is no exact screening tool for it, but we see in about 15% of patients, usually the more locally advanced ones, patients will have flank pain, almost like a kidney stone. They may have blood in their urine, and so those are two things that may suggest a more locally advanced. Not everybody that has those symptoms has advanced kidney cancers, but those are the ones that can present as well.
Okay. What treatment options are available for patients with kidney cancer?
So there's several treatments. It's very much what we call a surgical disease, which means if you do surgery on it and you're successful in removing either the whole kidney or part of the kidney, depending on how big the mass is, ideally that's all the treatment they need. So we would follow those patients with surveillance CT scans and ultrasounds after that. So it's a very surgical disease. It's very treatable in sort of the localized setting. Even some patients that have comorbidities, maybe they have a bad heart or they have diabetes, they have pulmonary problems. If they have a 1 to 2 centimeter mass, we may just do surveillance on that, which means that we'll follow it with a series of ultrasounds and CT scans, and we know that the risk of the tumor spreading outside the kidney less than 3 centimeters is pretty low. So in certain patients with comorbidities, we may watch that for a while. And so when we get into the more advanced disease, so either locally advanced surrounding structures or metastases to the lungs, liver, the bone is most common, then we move into a whole different realm of treatment, which is called systemic therapy. So we've got a lot of exciting immunotherapies, a lot of which we're using here at the Cancer Center, and one of my medical oncology partners, Dr. Parikh, is involved in clinical trials with that, and he's at the front line of sort of the immunotherapy treatment for kidney cancer. And we've got some other sort of targeted therapies that we've used over the last decade or so. But really the immunotherapy in sort of the metastatic setting has really been a great game changer. It's pretty well tolerated, and we've seen some remarkable responses to that.
Okay. Talk about the psychological side effects associated with a kidney cancer diagnosis and the subsequent side effects of the treatment that you just talked about.
Yeah, so I know that one of my big clinical and research focuses is the mental health and sort of psychological aspect of cancer, and kidney cancer certainly hasn't had as much of, let's say, press as say prostate cancer, bladder cancer, but any cancer diagnosis can lead to psychological side effects and depression associated with that. So that certainly is the case for kidney cancer patients as well. Now, specific to their treatment, depending how big the surgery is, we may have to make a big incision down the midline, a big one on the side, and so there's post-op recovery from that. There's pain. There's all the sort of fatigue that goes along with the cancer surgery recovery as well. And in terms of when we get into the more of the advanced stuff, the side effects of the immunotherapy, fatigue, anemia, to name a few. So there certainly is specific side effects related to the treatments, but just generally the cancer diagnosis always is a big one for psychological aspects as well.
Okay.
Question?
Thank you. So the last question we have about kidney cancer, and then we have another question about the coronavirus.
Sure.
But we'll finish kidney cancer
Yeah.
first. What can patients expect when they come to the cancer center and have a diagnosis of kidney cancer, maybe from their primary care physician?
Certainly. So what you can expect is, especially if it's a localized, so it's just in the kidney, you'll see myself or one of my two colleagues, Dr. Martha Terrace or Robbie Mahdi, we're the three people that are the surgeons that treat the kidney cancer. And so we'll go through we'll show you pictures of the mass so you can see exactly what we're talking about, because all of it's sort of theoretical, so you can sort of see what it looks like on an MRI or a CT scan. And then we'll talk about options. The options may be that we can do a surgery where we just take part of the kidney with the tumor and save the rest of the kidney. That's ideal, because 1.5 kidneys is better than one.
Yeah.
Certainly if it's a little bit bigger and it's safer just to remove the whole kidney, we'll discuss what that entails, whether it's through robotic approach, which is minimally invasive, or if it's big enough, we may have to do sort of an old-fashioned big incision to get it out. So we'll go through a lot of options, and certainly, as I mentioned before, with the surveillance, we may just say, all right, this is a small mass, let's say it's 1.5 centimeters, we're gonna get an ultrasound in 6 months, and just sort of reassuring the patient that the risk of it spreading at that size is so low that we feel it's safe, that most people, if they want a period of surveillance, it's not unreasonable.
Okay. All right. So as I promised and as I mentioned, we do have another question regarding COVID-19, the coronavirus.
Mm-hmm.
This person wants to know, is the Cancer Center's outpatient services clinic screening patients that visit?
So we're not screening in terms of the test, but we're certainly taking precautions in terms of how patients are feeling. We're trying to at least, let's say you have a yearly follow-up, we may move that back a little bit just so you're not coming in and being exposed to it, or bring in exposure from the community. So we're not directly testing. We've talked a little bit about maybe doing temperature checks if you're not feeling good. If you have a fever, maybe we have a quarantine area if we need it. So we're being very precautious. Obviously, it's not just the patients that are coming in for their clinic visits, but the patients that are maybe on the second floor getting their chemotherapy. So we really have to be vigilant, and if we can delay a regular follow-up for a couple of weeks or a month, and it's not going to affect anything long-term, I think that's reasonable. But certainly, like I said, life goes on. We have patients that we need to be in touch with and to see in person, and still schedule chemotherapy or surgery if we need to.
Okay. Well, those are all the questions we have right now. Dr. Clausen, thank you for joining me.
Always my pleasure.
I do want to mention one thing real quick. We did a Facebook Live about a week or two ago with Rachel Johannick and Sarah Dean, our nutritionist at the Cancer Center. You may have noticed that the video was the wrong orientation, so that has been fixed, and we will be posting that video with the correct orientation so you don't have to turn your heads to try and watch it. Sorry for that, it does happen, but thank you for joining us. Thank you for joining me.
Thanks.
Y'all have a wonderful rest of your day.